I welcome you to the world of medicine. We've got a great topic for the show. It's a topic that, well, really expands into some areas of our being that most people really wonder about. What's it like to be a twin? What's it like to be a triplet? What are some of the issues families who have twins and triplets, or even more multiples, might have? What are some of their logistical problems? What are some of their emotional problems? What are the medical issues? Well, we're going to touch on a lot of these things in the show. We've got a great audience, people who have been taking care of kids. They have triplets, they have twins. We have some incredible experts. Dr. Ed Koch is a former obstetrician. He's had many of these high-risk pregnancies that he's taken care of in his career. But more importantly and more incredibly, Dr. Koch is a grandparent of 2 sets of triplets, in addition to his own twin children. Dr. Melody Unikel is a pediatrician. She works at Virginia Pediatric Group. She's an excellent clinician, and she has quite a few twin families that she takes care of. Sharon Weis is a behavioral consultant. She is the author of a great book, From Chaos to Calm. She works with families to help them figure out how to make their lives work, how to keep organization, how to keep people working together in a family setting. And Dr. Barry Ekdom, he's a clinical neuropsychologist. He works here in Fairfax. He does all kinds of neuropsychiatric, neuropsychological, and learning type testing. He could really help refine and find the things that are going on with kids who are having problems. Starting with you, Dr. Koch.
Good evening.
How are you? It's great
I'm
to see you. Good. We have twins. I mean, it seems to those who aren't twins that, well, there must not be that many of them out there, but really, what are the kinds of numbers we're talking about when we talk about these multiple pregnancies?
Well, in the last 25 years, we've seen a boom in vitro fertilization and reproductive endocrinology techniques. So we've seen a higher incidence of multiples, especially twins and triplets. And there were some difficulties 25 years ago in terms of with prematurity and having these children spend a lot of time in the intensive care unit or deliver early and all the things that come about from that. But the reproductive endocrinologists have done a really good job over the last 10 years of reducing the number of quads and triplets and pretty much settling down on twins and singletons. But
that's great.
That and the combination of the fact that so many of the young ladies that are professionals are putting off their children until they're over 30 has also increased the incidence of multiples.
So we have twins. When I see numbers, I see something like 3% of deliveries are for twins. And then, of course, significantly smaller numbers as you get into higher multiples. So that's a pretty significant number when you think about, well, over 4 million births a year, you're talking about 170, 180,000 twins being born. It doesn't seem like there could be that many, but it sure does seem like it's happening that way. Do people have any inclination that they're going to have twins? Do you have any idea when you went into your marriage that, oh yeah, I want to have twins, it's going to work just perfect that way?
Absolutely not. I had no idea I was going to have twins.
And Dr. Koch was talking about some of those, well, risk factors or whatever you want to call them if it's a risk, but did you have any of those kinds of things in your family?
No, not at that time, and mine are genetically identical. And I was young, I was 28. I was young at the time, right. I thought. Yes. But no.
Well, that would be considered still in the younger side.
I hope
yes,
so.
Yes, that's true, that's true. And we won't ask how old your twins are now, but that's okay too. Yeah, you're looking great for, I know you're twins too. Nonetheless, so you really had no inclination, you had no thoughts. And did you have any twins in your family?
None.
None. So, and none in yours either?
None in mine, no.
Great. Did you have any idea that you, as well, could have twins?
No, I wasn't expecting to have twins. No, I found out on my 8th week when I went for my sonogram, and the doctor said she saw a heartbeat. And then she goes, "Wait a minute, I see another heartbeat." And then she gave me a box of Kleenex and left the room. I don't know what the box of Kleenex was for. And she gave me a set of instructions: when you tell your husband, make sure that you have him sit down on the couch. I don't know where it was coming from. But anyhow, I got out, went back home, and did exactly what she had asked me to do, and I'm glad I did that.
Right. How long did it take him to recover?
Let me say, when I got to know that we were pregnant,
Right.
he had made out a whole spreadsheet. He's a numbers guy.
All right.
And that night he spent working on that spreadsheet quite a bit. So that's how
It really changed his perspective.
it did.
Yeah.
It did.
I'm
a
sure it
lot.
did.
Yes.
That's great. Your father is twin.
Yes, yeah.
And was there any history in the family?
No, none at all. It was a
No.
big surprise. So we weren't expecting it at all, and sonogram came up with showing twins was a big
Right.
surprise.
Wow. And you managed to add one more.
I did.
Yes.
I had actually hoped for twins. My mom was a twin, and I thought it'd be great to have a boy and a girl twin and just be done. And we unfortunately weren't able to have children on our own very easily, and so we had a little reproductive help, and I overachieved with triplets.
I
But
see.
it was going to the first appointment and having a sonogram and seeing three somethings on the screen and trying to figure out what those three things should be until the doctor told us it was heartbeats. And it was a good thing I was lying down because I think I would have passed out if I hadn't.
Well, that's a pretty big thing right there. You were one of those things. And- I see. Yeah, well, we'll have to hear more about what it was like at that moment for you. if
He
you
was
can recall.
crowded.
He was crowded, yeah, I guess. So that went reasonably quickly, and of course, you have Dr. Koch's family history as well,
Right.
with your twins and then your subsequent grand triplets. Pretty amazing.
It is amazing.
It's truly amazing. So when people go through the fertility, and they sometimes, I guess as you were saying back when, they were much less able to predict how many of those fertilized eggs might work, so that they were often finding ways to try to deal with a pregnancy. But I guess having that many babies really puts you into a different physical state. What happens to the moms when they have that many babies that they're carrying? I mean, it must have made you uncomfortable really quick.
Actually, I have the advantage of being tall, so it wasn't as bad for me. I was in the hospital just before the children were born, and there was a woman in the room next to me who was 5'2", and she was having triplets, and she basically ran out of room to grow, and it really was very, very uncomfortable.
Yeah. So what are some of the things, Dr. Koch, that we see with families and with some of those potentially problematic with multiple pregnancies?
Well, you think about all the physiologic issues that can come about in pregnancy, and then they are exacerbated because of just multiple. So, for instance, the unpleasantness of nausea and vomiting during the first trimester more commonly occurs in women that are carrying twins and triplets. Anemia gets to be a problem. Nutritionally, the women have to eat more calories. And then, of course, there's the issue of, as Jean was saying, getting big and bigger and bigger. And starting at about 34 or 35 weeks of the pregnancy, then you start having the issues with potential prematurity and the cervix dilating and needing bed rest and what have you.
Well, that of course is very interesting. Of course, we have a really cute couple of kids here, some twins, and you had to go through some of that. Let's say the kinds of difficulties that Dr. Koch's talking about. Give us a little perspective on what happened during your twin pregnancy.
Yes, basically at 22 weeks, I ended up in the hospital with a little bleeding. And from there, I stayed at the hospital for up to 34 weeks until they were delivered, basically because I had a placenta previa.
Okay, so you had a placental issue, which can happen in any pregnancy, and it was such that it really put those twins at risk. So premature labor before a certain time really puts them, well, at a non-survival. But then as you keep moving out, and Dr. Unikel, what happens? I mean, obviously, what's about the gestational age that someone can deliver a potentially viable baby?
Oh, well, you can have a viable baby that's premature very early, I mean, 25, 26 weeks. But there will be complications in a baby that young.
So the goal is to keep them in utero as long as you possibly can.
That is correct,
Right, yes.
as she did.
Yes, as she did. So sometimes that means living in the hospital. Now, you have twins.
I do.
Yes.
We also have identical twins, and they were a little bit of a surprise. While dating, though, my husband did warn me that identical twins ran in his family, and I did not take him seriously. Love is blind. So we've, but I also had a baby first, and so when my older daughter was 8 months old, I found out we were having twins.
Oh, really?
Yes.
So you
we
were
have-
really living on the edge.
We've got Irish triplets, and I also was in the hospital, and around 21 weeks found out that my pregnancy wasn't holding, and it was very scary. So, but having a baby at home, our doctors were fantastic, and they allowed me to go home on bed rest, provided I complied. And
There's nothing more exhausting than bed rest, is there?
well, they'll tell you that, bed rest sounds exotic to those of us who have busy lives, but when they give you actually medicine called terbutaline, which is essentially something that speeds up your heart rate to hold the pregnancy, you're essentially drinking 10 cups of coffee and trying to stay in bed. So that's not as
not easy.
comfortable.
Right, yeah, I would imagine.
No, but we were fortunate, and we got to about 31 weeks. Also had lots of complications, but luckily our twins were delivered. They were feeder growers, so no complications, but they were 3 pounds each.
So 3 pounds, pretty small. We probably see some kinds of complications in those babies. When we talk about the medical issues with premature babies, they end up in a special part of the hospital. And a very unique environment there as well.
Mm-hmm.
Let me move away from our chorus. We have a volunteer chorus here that's giving us a little extra sound so that we don't get too bored, we don't fall asleep here. Right? Nonetheless, so we have a NICU, neonatal intensive care unit, which is like being in some other planetary lab. It's a remarkable place. And so we can take care of babies who are very, very young and actually create that environment that they are supposed to be in still, but really aren't.
Mm-hmm.
So it's great. There we go. That's good. You had no problems with your delivery?
I actually was put on bed rest at
Yes.
20. I was working full time, and my OB said it would be in my best interest to go on bed rest at 26 weeks.
Okay.
This was a long time ago.
Right.
This was years ago, 18
So that
years
was
ago.
precautionary.
So I was put on bed rest from 26 weeks to 37 and a half weeks, but I got toxemic and then ended up going into full eclampsia, and I ended up in kidney failure after I delivered my
Right.
twins. So my twins were ready to come home from the hospital before I was.
Wow. So did you recover from the kidney failure?
I absolutely did. And then I had 2
That's great.
subsequent
That's
singletons,
great.
and
Okay.
I was fine with those
Nothing
births.
happened there. Okay,
No.
well, that's great. When you guys found out that you were carrying twins, I mean, it really must have sort of changed your whole experience in life. I mean, you had no anticipation that, my God, instant family, this is going to happen this way.
No, talk about the handkerchief. I cried and cried at my sonogram. I sobbed and sobbed. What the heck? I blamed him for a long time.
It's my fault.
Yeah. Well, at least
He said that for 20 years.
Strong shoulders, right?
Good man.
And it will always be your fault. That's
Always.
Let's not stay married.
That's why we're so happily married.
Yes, well, but it really does create a whole new set of pressures. And as we were hearing before, we had a number cruncher who basically focused on that. And you were probably focusing on something else, wondering, well, am I going to have at least maybe a battery, a pitcher and a catcher or something like that at the time? You're probably wondering, what's going to happen? Did you think you needed any kind of counseling? I mean, did you seek out any help or any kind of support from anywhere out there?
Well, he had just gotten out of law school, and I was working a busy full-time job. So he was so busy trying to start a law practice up and then I got put on bed rest. It rocked our world, and I was too depressed, I think, to seek for help. I don't know. I wasn't thinking straight. My hormones were out of whack, and we were just trying to survive, thinking, what is going to happen to our lives with me on bed rest, him starting a law practice, and
Sure.
yeah.
Do we ever use counseling? I mean, do you ever get called to talk to families, Sharon?
I do child behavior.
You do child behavior, so you're not anticipating
The
that
fact
they're
that
going to
it's
need
never
it.
his fault and she's sobbing, not my issue.
So you have identical twins,
Yes, we have identical twins, Caroline and Catherine.
Carolyn and Catherine, girls. That's Gwen.
We
That's
have 3 girls.
3 girls.
Actually, 4 girls if you count our 24-year-old in law school.
Really.
Yes.
So you've sort of run the spectrum there of girl issues. But when those babies were born, could you tell them apart?
You know, that's a really great question because it terrified me to take the children home from the hospital and not find a way to identify them. So the NICU nurses at Fairfax Hospital were terrific. And they just gave us a little hint of maybe take a little nail polish.
Right.
Because the one thing about preemies is that they grow very fast. And so they outgrew the little bands on their wrist. And so we had painted a toe of each child, and that's actually how we identified them.
Right. And I'm sure you wrote down which toe it was somewhere.
We did.
Just in case
We
you
did,
forget
but,
that one. Right.
but just in case, we actually asked the NICU nurses if anybody had ever mixed up their twins,
Yeah.
and she says it happens all the time.
And
that-
does it really matter anyway?
and it-
Especially
well,
they're identical.
No, she
I
also
don't know.
said that they actually know by their echocardiogram. They know by their heartbeat that they have.
So I guess before they have teeth, they can't have those dental records. They have their echocardiogram. Well, fortunately, they didn't say their sonogram of their brain. Yes, we don't want to find any differences that way. So you had initially a difficult time telling them apart. How about now? Do people have a hard time?
You know, we have them in different classes at school on purpose. They get confused regularly. They are well adjusted because they'll turn around even to mommy and daddy and say, "Mom, I'm Caroline," or "I'm Catherine." And so, you know, we do tell them apart, but there are some days when there's a weight difference or when their weight's the same, we can really, you know, confuse them.
Yeah, I would imagine. So there is a unique issue with those identical twins. And through the years, have they had similar medical kinds of problems? I mean, have they really had anything that has been characteristic that was fairly unique and they both had it?
Well, we just actually had a dental exam, and it was actually very interesting because the dentist had done the evaluation of both twins, looked up into my face and said, they have the exact same mouth.
Wow.
They have the exact same wearing of teeth. They are, you know, just literally carbon copies of each other. So it kind of drives it home.
Right.
That these
Well, and that's
children
interesting.
are very
It's
much the same.
not just that the anatomy is the same, but the exhibition of stress, grinding their teeth, the way they use their teeth, the way they chew.
But their
was
personalities
evidence.
are so different.
Are they?
And
Yeah.
so having identical children, they literally have polar opposite personalities.
Wow.
So it's kind of fun.
Right. So, but that's the extent of it. They've been very healthy kids then.
Thank goodness. When you leave the NICU and you have children that don't have issues, you never complain, no matter how tired you are. You get to see the inside of the NICU.
And did you have
feel
help when you went
blessed.
home?
I had a great piece of advice. We are not blessed with enormous financial resources, but we had a great piece of advice that somebody said, you hire as much help as you possibly can afford. And it was actually really great advice at the time because as a mom of 3 little ones, we were thoroughly exhausted. And so, I mean, especially when you bring home preemies, our girls were just barely 4 pounds apiece, and being feeder growers, you've got to really make sure that you're on top of the feedings and whatnot. So we had one night a week where we had a babysitter do the overnights, but my husband and I managed very, very well. He did the 10 o'clock to 2 o'clock, and I still, to this day, and the twins are 7, I still wake up at 2:30 in the morning. The
Really?
same time as the feeding time.
Well, and were you breastfeeding at that time? Did you do any
We
breastfeeding
did.
with it? So I hope it's not, well,
No,
okay,
no, no.
yes.
We wound up, you know, they tell you that breast milk is extremely important for your twins, but I also believe that if it's a stress on the family, that you do the best that you can.
Right.
And so what I want to make sure is that people don't feel guilty for not being able to breastfeed until they're, you know, very, very.
Dr. Unikel, do we see most moms of twins try to breastfeed both?
I'd say I see half of them,
Half
you know,
of
half
them.
and half.
And it's
So-
not one A versus B in the same family. Although,
Oh,
has
no.
that ever happened? You ever see
No,
them?
I think from what I've seen, a mom either breastfeeds both or she bottle feeds both.
And it certainly, it's something they really can do. I think there's probably some doubt in their minds when they start.
I think even for mothers of single babies, there's an adaptation of learning how to get the baby adjusted and the mom adjusted to a feeding schedule. So,
Well, we also just, to kind of piggyback onto that, when you have twins, I don't think it's either or. You're sent home from the hospital, they're given excellent formula, and so you can just kind of do both and not stress out.
Right. And I think that that's what most people end up doing for the most part. Postpartum depression is a big issue with moms. And of course, we know that statistically, there's somewhere about 15 to 18% of adults have some form of either, well, let's say passing depression or more chronic kinds of issues. And that having a baby seems to really bring it out. Did you have any issues with postpartum depression?
I think that I did. Also, having other kids at home and feeling the enormous stress of managing so many moving parts in a household. Looking back, I think I actually even had more post-traumatic stress disorder, PTSD, coming home from the NICU. And so that was really
the
important.
NICU is an adventure, yes.
Yeah.
And it can leave you with some really scary moments. I mean, babies have, when they're born prematurely, they have a pattern of certain problems that we anticipate, we know what to do in the NICU, but you see them and you're just waiting for them to happen. It's like waiting for that person to run the stop sign, and you're driving. You just have to be aware of what you're looking for, and that's what they are there. But for you, it's a total shock when those things happen.
It is, but we have an enormous support system in our OBs and pediatricians and other help. So
Yeah. So organizing, Sharon, I mean, that's got to be one of the traits that successful multiple parents have to really be able to master.
It certainly would be nice. I think it's more of a challenge for them. And one of the points, there's 2 points I want to make. There are some families that come home, they have multiples, and that's it. But more often the case, particularly if I'm working with families, there's another child. And I think realizing that spending time with them individually, when you first bring home and you want to organize your household, if you have a child that's there that's a toddler, that child is not good at keeping their hands off of anything. And there's actually some things that you can do to help them understand, because a parent can't be in 3 places at the same time. And if one child starts to cry that's a multiple, that's a twin, and there's the other one who's not, but you don't want to leave her there, and then there's the toddler who's real interested in playing with anything that hasn't moved away from it, you've got to have a system for organization. You have to know that you're going to have them, it's better before the babies are born to help a toddler know if you see a red line, it means don't pass, don't cross it, don't touch what's beyond it, because it's hard to organize all your children, and you're actually talking about organizing your day. And I think probably keeping in mind that the child that's already there has a set of expectations and hasn't lived with multiples before and can't make the adjustment without your help. So when you say organization, I really like parents to be able to spend some time, not just to say this baby's coming home, want to practice holding it, but this baby's coming home, help them understand what happens when mommy can't hold them or tell them a story right then. Practice, setting a timer and saying I'm going to be 5 minutes and then I'm going to come back in. Help them learn where not to touch and where to touch, because I think that child is going to lose the parental attention at the very same time that you're expecting to have additional organization with more stress and less time. And the other aspect is that I think almost forever, and people here who are non-twins with twin families can attest to the fact that if you're walking along and a parent has twins, the other child becomes very used to very quickly, oh, look at the twins. And there's this child standing there that's not a twin. And so really just finding a way to give some special identity to the child who's not a multiple is going to be very helpful. Doesn't exactly answer the question you asked. But
Well, no, but it's really very helpful and very insightful. So when these babies come home and the families are trying to figure out how to situate themselves with their other kids. I mean, very honestly, it doesn't matter if you came home with one. If you have a toddler at home,
You bet.
it's all
Right.
craziness breaking loose for
Right.
sure.
Yes.
They're at a point in their lives where they're demanding. They have no frustration tolerance. They're ready to throw a tantrum at the snap of your fingers. And then you're coming home, you're exhausted. You have to take care of these babies who may be high risk and may have feeding difficulties. I mean, feeding a baby can take an hour sometimes, and then an hour later you got to do it again.
Right.
And if they're fussy with reflux or any of the kinds of usual things that they have, boy, that can wreak havoc on your lives.
Right.
So the idea of identical twins, I'd love to explore that a little bit more. Were your babies indistinguishable at birth?
Oh, absolutely.
Absolutely, yeah.
Oh, they were like 1.5 pounds apart, but we also polished one's nail. The other one was polished and the other one wasn't.
So the indelible magic marker isn't the best idea. It's the nail polish that
It
works
was the
better?
nail polish
Right.
that they told me to
Okay,
use, but
yeah.
I still got them mixed up. I was so sleep deprived because I nursed them both at the same time. If one would cry, at first I didn't do that, and I would nurse the same one twice sometimes and wonder why it was still crying. But then I figured out if one cried, I got them both up and I nursed them both together.
Well,
Yeah.
there are all kinds of techniques. I'm sure you employed that. And going back to the medical issues, as we see with identical twins, the teeth were identical, and the dentist was totally blown away by that. Obviously, hadn't seen a lot of identical twins because I imagine you've heard that before.
I mean, I've heard they've been the mirror image.
The mirror image,
teeth,
really,
the
yes.
teeth are they're opposite. You know,
Right.
the molar comes in on the left, the other one's molar comes in on the right.
Really? Oh
Yeah.
boy, that's
Yeah.
that's living together, I would say.
That is living together.
But let's say there are some unique differences that you've experienced with your babies.
There are.
Yes. And at what point, let's say, so most of the time when we have prematures, we're always looking to see if there are some developmental issues, if they're coming along the normal way. And you can't help but compare. What are the kinds of things that we are watching for closely, especially with those who are born a little prematurely?
Well, you're watching to make sure that they're making progress in their speech development, and their language development, and their fine motor skills. But just because they're identical doesn't mean they're going to reach those milestones at the same time. So they still have to be treated individually
Right.
on each milestone.
So with your kids, were they evolving on the same track?
No, one was the smaller one that was born first was always sicker. His immune system was worse, and they got a viral and RSV when they were younger, and they had a lot of respiratory issues and a lot of problems, and then they ended up having a lot of developmental disabilities, and the one that was always chronically sicker was more affected than the other one.
And you sort of figure, well, let's say I've done a show on kidney transplants, and there's nothing like having an identical twin because you don't have to take any immune suppressing drugs. You have the exact same antigens, so you don't have any kind of immune response or rejection phenomena. But in this situation, you're saying that you had a significant difference between your kids.
Yes.
And that was apparent at a fairly early age.
They were both affected about 18 months, but
Right.
then by the time they were 3 or 4, one was much higher functioning than the other one.
Interesting. So I know that some of the work that you had to sort of sort through to understand what was going on was performed by Dr. Ekdom.
Absolutely.
And at what age can you start to look at kids? And what do you do? Do you think that everybody who has twins or multiples should have any kind of testing done?
Not at all. I think that many multiples are fine. They develop normally. There's no concern for them. I think when parents do develop concerns, then testing is appropriate because you can figure out, is there a concern here? Is this something we should worry about or not? And the second thing is, if there is a problem, what is it and how should we help that child develop better?
And the big difference that Dr. Ekdom really had to deal with your kids was related to language.
Absolutely. They were both. One was absolutely nonverbal, and so we had to test a nonverbal child and the other one had some verbal skills. And it was, he was able to help me figure out what services and what I needed to get them help.
Okay. So that's not an easy thing to do. First of all, testing kids
No.
is a challenge in and of itself.
Absolutely.
And then to test them when they're nonverbal, that must be a significant challenge.
It is.
And is there some point where you can get some return on that as you watch them over time? You've had the opportunity to watch these
Yes,
children over time.
I think you can start with really basic testing on language assessment and language development, both language comprehension, what the child understands, and how well the child is expressing themselves. But you can also look at more nonverbal or visually based forms of reasoning and kind of intelligence. And when we see normal intelligence in the presence of some sort of a language delay, I think it predicts very well for a response to language therapy and things like that. We can also look at other concerns besides language, if there are those concerns later on in life, especially in the area of learning or attention. But the first concerns that people have in preschool are usually around language development, comprehension or expression.
Well, and of course, with the focus on autism and other kinds of issues relative to language development, it seems more and more pertinent. And to be able to have somebody who can do some of that screening early on in a way that could really define some of the issues is really important. Thank you. So you're sitting back, but you guys still have to identify together as twins, no?
No.
No? You don't think so?
No.
No, and you had said that pretty much they sort of went on their own tracks literally from day one.
Mm-hmm.
Yeah. But don't people still call you the twins?
Well, not really.
No?
Last year, our SAC teacher said, instead of saying Ipsa and Isha, I'll just call you Ipsha.
Ah.
Not
Oh,
Ipsha.
that was a sophisticated comment, wasn't it? Yes. So you guys have been pretty comfortable with your individual development, your personalities, and being different people altogether.
Yeah.
Yeah. Do you guys compete?
Yes.
Yes? So you do compete, and what do you compete at? What kinds of things?
Grades.
Grades. Oh, so that's a virtuous thing to compete for. Better grades, and I won't ask who gets better grades, and don't tell me, okay? I don't want to know, but it's interesting when you talk about twins and you talk about what they go through in terms of their own individuation, their development, and their self-esteem, I guess. A perspective on twins versus singletons relative to how they can identify themselves. There are certain stages where we see that.
I think they are often natural companions. They often have their own little language as they play together and they develop. But I believe a great deal of that is, nature nurture. They pop out and they have this way of interacting with each other and with the world. But it's really the parents. The parents can make a big difference in helping them understand that they are individuals, dressing them differently, exposing them to different activities, because their strengths aren't going to match equally down the line. And you want to help them figure out what their own strengths are and their own passion and let them pursue that separately. I think the biggest problem for parents is it's simply easier and there's so much available that to take them both to the same activity, I mean, parents do that with 3 singles.
Right.
So they are, of course, going to want to do that with twins. But it is possible to have identical twins, and one's your artist and one's your athlete, and that's the direction that parents can help them, the path they help them pursue.
It's interesting. Now, with 3, were they really distinguishable personality-wise literally from day one?
Probably from day 2.
From day 2. Okay, you weren't awake day 1.
Pretty much not.
Okay. And obviously, there are issues when you're a multiple. So certainly we know that people call people the twins. And I can't imagine you don't get the triplets.
We do.
Yeah. Does it bother you at all?
I think in some settings it's annoying because there's no distinguish between individuality. So like when I'm introducing myself to somebody, I'm not going to automatically say, oh, I'm a triplet, because that leads to a comparison automatically between people, and I don't necessarily want that.
Right.
But, you know, in like a church setting where you've grown up with those people, we're the triplets because that's how they've always known us from birth. So I think it depends.
And of course, you have two sisters, and that gives you a little bit of dominancy, especially if you've grown to be a little bit bigger. But in those early years, how did you identify? Did you find that you felt that they were your closest friends?
Yeah, I mean, we didn't go to preschool or anything. It was us and a babysitter until kindergarten. So for 5 years, it was just the three of us. We'd go to the pool, swim around and stuff.
So you guys got to be pretty comfortable with each other. You got to know each other pretty well, I would say. And you can't imagine that other people would know you, no matter how close your friends are, like you guys know each other. Yeah. I mean, is that a bond that is important to you?
Yeah.
Yeah, it's a beautiful thing. I think it's really neat. It is. You're laughing because they don't show it now, but you know one day they'll feel it.
Well, it depends on who has to borrow whose clothes,
I
who left
see.
whose homework at school. So, but yeah, I think that we're going through the normal teenager trying to be our own person kind of thing. But I think when they get out of the house and have their own lives, that they will end up being really good friends.
Right. So, and as we were saying, that individuation time, I guess there's one there in preschool, more or less, that 3 to 5 year range. And of course, there's the early one in the first year, but really when kids start to separate that way, and then I guess when they're adolescents.
Yes, but an interesting aspect is for any child development, in terms of supervision, parents tend to supervise play or be very much a part of children's play up through the age of 5 or 6. But from 6 to 10 is when kids are developing their own style of play, and multiples have this experience of always having a play date, a built-in play date, or a playmate, and they play well with each other, but it doesn't necessarily mean it's going to translate to the outside world. 6 to 10, even teachers stop being involved in what the dynamic is between kids. And so, you know, I don't mean this disrespectfully, but teachers are out on the playground in preschool and in kindergarten, and they're actually supporting the form of play that kids have. Past 6 years old, they're sort of out there for what I call blood and flames. It's a safety issue, but they're not necessarily supporting the play. And I think that if people realize that the play that they did at home, the play that they did with each other, does not necessarily make them equally skilled when they go out into the community, because they will expect their peer group. I think it's extremely interesting that they did it as triplets. When they went out into the community, the expectation for how a peer would relate to them may not meet their past expectations, because you know your sibling, you know how they're going to operate, but you may not know the person on the playground that way. And I think it'd be good if parents coach and spend some time having them do play dates, even if they're multiples.
Yeah. You're wearing a soccer uniform.
Yeah.
Yeah? So you love to play soccer?
Mm-hmm.
Yeah. And does your brother, you have a brother?
Yeah.
He likes to play soccer too?
Yeah, he's on my soccer team.
Oh, so you guys are on the same team?
Yeah.
Are you in the same class at school?
No.
No. When do you remember when you guys separated in school?
Kindergarten.
In kindergarten? Okay. So when you started school, you decided it was time that we created our own identities.
Yeah.
How about on the soccer field?
Yeah.
Yeah? Okay.
He broke his collarbone, so he has less playing time on the field.
I see.
and I
That's
have
a
more.
shame. Okay. So he was playing hard and took a fall, huh? Yeah, it happens like that. So you guys are in separate classes?
Yeah.
And that works? Do you have separate groups of friends?
Not really.
No, you still have pretty much the same friends? Yeah. Do you guys have other activities that are different from each other's?
Not really.
Not now, right? Do you think you're going to develop different interests as you guys get older?
Yeah.
Yeah. It's pretty comforting. Do you live in the same bedroom? You
No.
share a bedroom? No? So you have your own room?
Mhm.
Yeah. How about when you have a birthday? Do you have separate cakes, or you have one cake? How does that work?
We have the same cake.
You have the same cake. Okay. Do you both blow out the candles at the same time?
Yeah.
Yeah, that's kind of cool. I like that. That celebrates that moment of birth when you guys did it together, right? Yeah. And that's That's not the way you guys live, though.
No, we don't.
No.
We've always had, even their first birthday, I made sure that we got 2 separate cakes.
2 separate cakes.
And
Okay,
that's
so
how
you're
we've always
encouraging that
done.
independence, that individual. Right. So you have your own cake.
Yes.
Do you guys like the same flavor?
No.
No.
Not
Okay.
really.
Are you sure you guys are twins? Yeah. All right. All
Well,
right.
luckily, one of my SAC teachers didn't know me and Ishan were twins, so until our other SAC teacher had to tell him.
I see. All right. Well, I can understand that. Sure. So those are all pretty important things. I want to hear, though, the way people perceive multiples. There have got to be things that people say that drive you crazy.
Ask me where my sisters are.
Oh, that really does it, right?
Yeah.
So they figure you'd know, always.
You know, their friends will come up to me, hey, where's Anna? Well, you know, I don't know.
Is there not that extrasensory perception, that
No.
telepathy that exists between siblings that were that close in utero?
No.
Not even close?
No.
No. So what other kinds of things do people think about when they see the fact that you guys are triplets? Are there any other things that come up that really annoy you?
The school classes we take, they try to compare how well we do in school, what our interests are, and they just assume that we're the same person.
Right.
My sister and I especially, not necessarily David, but that's kind of annoying.
Yeah, I imagine, but it sounds like things are going pretty well for you guys that way.
Yeah.
Yeah, that's good. That's good. And anything that you can comment on from that perspective? Have you been seeing things that annoy you as a parent of a triplet when people sort of assume certain things about their behavior, their lifestyles, and things of that nature?
I think the hard thing for me is that it's my first time being a parent, so I don't get to learn from experience and apply the lesson later. But they're all very, very different. So David walked a month or 2 before the girls did, and Anna talked before her sister did, and having to try and figure out what's normal.
Right.
And you expect that one's potty trained, so the other one should get potty trained soon, but it doesn't necessarily happen that way because they're different.
Right.
So balancing that and trying to figure out what's the norm. Should everybody be able to get A in geometry, or is it really different? Trying to figure out the balance of that is hard.
Yeah, I would imagine. And it's pretty natural to compare. It really would be very natural to compare. And I guess that once again goes back to doing some of the testing and seeing what really is more sophisticated from their internal working point of view. Dr. Koch, you've been grandparent to 2 sets of triplets. How old are the other triplets?
The other triplets are 12.
12, okay.
And they have quite a different health history. They were all under 3 pounds. And so they have some different issues. And fortunately, they're all very smart kids. They were all treated, the mom was treated with mag sulfate during her premature labor for several weeks. And so the littlest one still is the littlest one, and she has some issues with getting tired and dehydrated and things like that. And the gal that weighed the most is of normal size and you know, fits in with all the other kids in class. And then there's the guy in the middle, like David's the guy in the middle. We have Kyle's the guy in the middle, and he's very talented, very artistic, but he's the middle size between the tiniest petite gal and the normal size gal.
So when we have behavioral issues, obviously one really interesting one is the potty training one, because I can't imagine having to go through that 3 times consecutively, or having big gaps of time in between and not knowing whether you're going to have diapers on one and forgetting which one was supposed to be in the diapers and all those kinds of things. But I know that there are issues that come up when you have multiples in a household. And you've worked with Sharon on some of the behavioral issues. And I guess there are times in a life where you get out of control. And I imagine when there are multiples around, it gets easily out of control. What did you start to work on? What were the issues that you were looking at when you started to think about how you're going to intervene from a behavioral point of view with your kids?
Well, we just knew we needed help. And so we went to Sharon. We needed help with how to do timeouts, how to get order in the house. just some of the routines like brushing teeth at night and getting all to bed. And so Sharon really gave us some structure for how to do that.
Give us a little perspective. So obviously kids know when they can run amok sometimes, and they really know how to push those buttons. Sometimes those buttons are preset and it's rather hereditary, and it's hard to respond in a way that is effective because it sort of recycles. And I guess you sort of see the behaviors probably that parents are just vulnerable and waiting for that kind of environment to develop, and they never really develop many of the coping skills with it.
Well, I think parents bring to the parenting table somewhat the way they were raised, but they have an expectation. You get so excited. There's nothing more emotional anyone ever does than raise children. But you don't picture yourself raising them the way it kind of turns out, because there are just these daily challenges. And I think most people come to me with the idea of, how do I get rid of a certain behavior? And I think in their case, it was one of those things where, one, heightening their awareness that particularly young children they really want adult positive feedback. Little kids want adult approval. And so what they're doing is generally because they don't know a better way to do it. And I think if parents can narrow the focus, and that was really part of it, and just find one part of the day instead of trying for anything all day, then they would be able to not only see the change as parents, but the children could understand and feel a lot better about how they're doing. And they were wonderful to work with, because it was saying, okay, let's take one slice of it and let's make sure that my child actually does understand what's expected in advance. I'm a very big believer in what I call planned parenting as opposed to Planned Parenthood. And that if you can just take one slice, plan for it in advance, make sure the expectations are clear, and give feedback. As much as people want to know how to change a negative behavior, if the routines go more smoothly, there's far less negative behavior.
Do you remember what the first behavior they tried to help you with?
Maybe you can tell them about the teeth brushing.
Well, we had I think it was like teeth brushing, because at first I just didn't want to do the toothbrushing because I was really tired and, well...
Seemed like a waste of time. Huh?
Yeah.
Yeah, who needs that? And of course, even though you have big, beautiful teeth that you want to take good care of, but you were saying, who needs that? And Mom was busy with your brother and trying to get things organized, and you were sort of skating on that one, getting away with it.
Yeah.
So what did Mom do to make it work?
Well, she
devised a little plan with
Do
you want
Sharon.
to show me?
Why don't you show me what you do?
We have all these, let's see here. This one's my chart.
So this is your chart right here. Which
and
I see.
these are some of the little and big prizes. So
I see. So when do you get a prize?
The bottom. Every time we get down to one of these, one of these things, we get something like one Pokemon card or a quarter.
I see. So you can be bought off, and you can learn your behaviors with material reinforcement. That's good.
When we get to the very end, we get one of the bigger things,
big ones.
like this.
Okay,
this,
that's great.
or
Good.
this.
That's fantastic. Well, that's good. So this is a technique that you will use. Certainly, I mean, it seems pretty obvious.
I do, but in fairness, I think each family is very different. And if you have 2 children at home and you come home with twins, or you have 1 child at home and you have triplets, or you just have triplets, which is not a just, you have triplets. As she said, there was no prior experience. You can't expect that every parent can address a behavior the same way, have the same level of understanding. There are parents who are working parents. There are parents that are working like dogs inside the home instead of outside the home. And understanding helping them narrow the focus and see what's a system that they can sustain over a period of time. Because there's going to be ups and downs no matter what. No matter what, there's going to be ups and downs.
Yeah. So, and in your book, you talk about a lot of those approaches to organization and to settling the chaos.
Yes, well, chaos to calm.
Create a little calm.
Yes.
And I know you've been taking care of, well, I guess the family issues with 2 sets of triplets and all those other kids in between as well. It must drive you crazy to try to figure, what are we going to do? It's a birthday, it's a graduation, it's something. You've got to do a lot with these families.
Yes, it is a lot. The good thing is there's more to love. Yeah. The challenge is identifying, excuse me, the finances, the cost of multiples. Right. When you buy a bike for a birthday, you buy 3 bikes. When they get to be 16, you are
Brutal.
looking at iPods.
Yes, yes. Oh, you weren't going to say cars, thank God, yes.
No,
right.
we're not there yet.
Yeah.
But even the cost of college. And, I enjoy very much going shopping with my granddaughters. And that can be quite expensive, the back-to-school clothes. They don't like to wear the same thing, so there is some consideration with cost and trying to be even and fair. Birthdays and holidays, you really have to have a budget.
Yeah. Well, I'm sure you do a good job. They're good kids. I know them all very well. And certainly I think it's been really a neat show. It's been neat talking about all the issues you all deal with, and they're all so very different. And I hope you've enjoyed it as well. And of course, that I always thank you for watching. And of course, until the next time, I'm Dr. Russell Libby, looking out for your health.